what is pre-diabetes or type 2 diabetes. My name's Catherine and I'm a diabetes dietitian. What we're going to do today is talk through what diabetes is and what are the things that affect our risk factors for developing pre-diabetes or type 2 diabetes. Now there's quite a few things that are completely out of our control and have an influence on that risk. So one of the things is your family history, your ethnicity and your age. And these are the things that we can't control. However, on the flip side is there's lots of things that we have got control or influence over that affect your potential risk factors of developing pre-diabetes or type 2 diabetes. These are things such as the activity levels, your body weight, the food choices we make, and whether we smoke. There's also things like stress and illness. They have an impact as well. But the main ones we're going to look at today are about our food choices and how activity has an influence on that. So we'll come back to those in a little while. But let's have a look what diabetes actually is, and we can see what happens in the body. So, for example, this person's is going to eat a sandwich. What happens to that when we've eaten it? So the food is broken down, goes into your stomach first, and it's broken down into three main nutrients. So for example, the bread would give us predominantly carbohydrates. Your filling, if it was some kind of meat or cheese, would give us protein and would also give us some fat. So those are the three main nutrients that our body breaks our food down into: carbohydrate, fat and protein. Now, for diabetes, what we know is that carbohydrate is the main nutrient that affects our blood glucose control and your management of diabetes. So let's look what happens to the carbohydrate. This is broken down into something called glucose. Now we're going to illustrate the glucose with these little yellow circles. So the glucose is released into your bloodstream, and we need that for energy. It's your body's main source of energy. But how do we get that glucose out of the blood and into the cells for you to use it? Well, our body needs to release a hormone called insulin. And our pancreas is stimulated and the hormone is released. Now we're going to depict insulin as a key because it acts like a key to the door. It opens the cell door and allows that glucose to move from the blood into that cell where you can use it as your energy source to do your day-to-day activities, and the blood glucose levels come back down again. But when we're looking at pre-diabetes and type 2 diabetes, this system isn't quite working right, and there's a couple of things that can get in the way. So we mentioned at the beginning that if you're carrying a little bit of extra weight, then the fat around the cells actually affects how that insulin works. And this is why we often talk about weight management, with managing and helping you to look after your diabetes, because this leads to something called insulin resistance. And we've got another film that we're going to talk about that in a lot more detail. But for now, we're just going to look at how this lock and key is affected by the fat around the cells. So if you can see, we've now got a bigger kind of keyhole, and what actually happens then is your body needs to produce a lot more insulin before it can take the glucose out of your blood. So your body's become resistant to its own insulin. What happens then is, over time, if we are asking our pancreas to produce more and more insulin, it starts to tire out, and then we might get the case where we're actually not producing enough insulin. And this is where some of you might be taking other kinds of medication that are needed to help your body to manage that. But really what we're going to try and focus on today is about what are those lifestyle factors that we can do that will have an impact on how your body utilises the glucose to help your own insulin work as effectively as possible. So let's have a think then. If we've got too much glucose in the blood, how might that make us feel? Now what you might have experienced that we call symptoms of raised blood glucose level is tiredness, thirst, and potentially going to the toilet more frequently. These are all symptoms of raised blood glucose levels. You don't always get them, it depends how high your blood glucose levels are. What we often say to people is that we find those symptoms will kick in if your blood glucose levels are above 10, because then the kind of range that we would like them to be in is between 4 and 7 millimoles per litre. So let's talk about how we might measure that. How will you know if they're between 4 and 7? So some of you, there's two ways. Some of you might have a blood glucose monitor at home and that you prick your finger and you check what it's like there and then. Another way of measuring it is something called a HbA1c. And this is something that your clinician, your practice nurse or your GP would measure for you. And that's taken from blood out of your arm. Now we've got a nice little model to illustrate this. So your HbA1c is, it checks your red blood cells, and when your blood glucose levels have been raised for a 2 to 3 month period, the red blood cells pick up lots of glucose. And that's how we can show and illustrate that your blood glucose has been raised over those previous 2 to 3 months. So this gives your GP or nurse the idea of how well managed or not your blood glucose levels have been over the last couple of months. So this one is to illustrate somebody who's had lots of glucose in their blood and they've got quite a high blood glucose level and therefore a high HbA1c. This is 86 millimoles per mole. So we talk about numbers, what do they actually mean? So let's have a look at the ranges of a HbA1c. So we know that if somebody's got a HbA1c of above 48 millimoles per mole, that puts them in the type 2 diabetes range. If you've got a blood HbA1c between 42 and 47 millimoles per mole, that puts you in the pre-diabetes range. And anything below 42 is what we would call the normal glycemic range or the normal blood glucose level. So you're out of that higher risk of developing diabetes. But what we'd really like to stress is that this is a two-way street. The numbers can either go up, but they can come back down again. So what we do know is with lifestyle management and looking at the types of food we eat and helping to influence how much glucose goes into your blood, you've got the ability to have more control, more management of potentially bringing your HbA1c down to below 48. So if somebody's already got type 2 diabetes, you could put it into the pre-diabetes range or even into the non-diabetic or non-diabetes range. So that would be below 42. So that would be our wish and hope for everybody, is that through some lifestyle changes, we can help to reduce that risk factor and risk of developing diabetes. What then? Let's have a look at today. So let's have a little bit of a summary. So we've mentioned that our main nutrient that affects our blood glucose levels is carbohydrate, and they come from our food. So when we eat lots and lots of carbohydrates, then we get an awful lot of glucose into our blood. So one of the key things that we can start to think about is, what could I do differently? After watching this film, is there something that you're already thinking, gosh, I do eat quite a lot of bread or pasta or rice? And if you'd like to know a lot more detail about the carbohydrate awareness and become more carbohydrate aware, then please go on to watch our next film. But for now, have a think. What kind of things could you do differently? And what we'd like you to think about at the end of each of these films is, after watching this, what could I change? What could I think about? And you might think after today, gosh, I'm a big bread eater and that's the thing I want to concentrate on. Or maybe I like lots of really sweet foods and that's the next thing. But first of all, have a think about your eating habits and also about your activity levels. This is more difficult for some people, and depending on your own personal situation, what we would like you to be aware of is that your body will also help to remove the glucose out of your blood the more active you are. And any types of activity will help. So to summarise, have a think. This is what our body is going to struggle with, and how are we going to help it to deal with that? How can we help so that those carbohydrates and the blood glucose levels aren't higher than they need to be? And you might want to look at our next film to start to really concentrate and home in on what are the dietary changes you can make and what are the abilities to change that. Now, as a final note, we have talked about that this is about type 2 diabetes. There are different types that you might have come across. So just to clarify at the end of this film, there's two main types of diabetes, type 1, and this is where people are usually, they could be born with it or usually diagnosed at an earlier age, and this is what's called an autoimmune disease. So the body has actually stopped producing any insulin at all, so they don't produce any keys, and people with type 1 diabetes always have to inject insulin, so they will always have to take medication. The type of diabetes we're talking about is type 2 diabetes, where for whatever reason, maybe it is because we've gained some weight, or there's been something happening that's affected your pancreas, so it started to produce less insulin. So type 2 diabetes, there's always some ability to start to look at what we're doing on a day-by-day basis to help us to manage our diabetes. So if ever any of you need to take more medication, that's part of treating it. But with type 1 diabetes, you will always take insulin, whereas with type 2, we have got the ability to, as we mentioned earlier, to progress it backwards from type 2 diabetes into pre-diabetes, and actually, can we put it into remission altogether?